Monica Akri and Ifra Aiden read news articles, so you don't have to. What's news in healthcare today? Let Monica and Ifra break it down for you.
Hello. Healthcare in the news. Hi and welcome. My name is Monica,
And I'm Ifra.
and we are with Healthcare for All Minnesota. And today we are talking about healthcare in the news.
Okay, so if you've ever looked at the prices of prescription drugs in the United States and thought, why is this so expensive? This March 2026 article is for you. It's called TrumpRx, Much Promised, Little Delivered. And today we're reading through it and breaking down what it actually means.
This article was written by Dr. Mark Brocky, a retired family practice physician who cared for patients in Coon Rapids, Minnesota for 41 years. During that time, he served on the boards of 2 health insurance companies, and he currently sits on the board of the educational nonprofit Healthcare for All Minnesota at hca-mn.org. Let's dive into the article that was published in the Land on March 2nd, 2026. We largely use Dr. Brocky's direct quotes, but we paraphrase a little and add commentary. Link to the original article is below in the description.
Prescription drugs are approximately 2 to 3 times as expensive in the United States as compared to the rest of the modern, prosperous world. The cost of prescription drugs is approximately 11% of the dollars spent for healthcare in the United States. Simple math says if U.S. prescription drugs cost the average of what other modern countries pay, our healthcare costs would drop significantly. If prescription drug prices fall, then insurance premiums can also fall.
What is it the United States needs to do so U.S. patients have affordable prices of prescription drugs? It will require that the price of all prescription drugs be negotiated by a state or national healthcare system. Drugs in the VA system are significantly cheaper than drugs at your local pharmacy. Some have argued that lowering the profits for the pharmaceutical companies will deprive the patients of new drugs, but careful analysis of this claim leads one to see that almost all the breakthrough drug discoveries are the result of university research, not drug company research. The drug companies do little cutting edge research.
Another useful step would be eliminating direct-to-consumer advertising of prescription drugs. The United States is one of the only countries in the world to allow drug companies to advertise prescription drugs to consumers. Very few patients are trained in pharmacology, anatomy, pathology, infectious diseases, or other aspects of diagnosing and treating illness. Most patients are not able to make informed decisions on how they should be treated. Doctors, nurse practitioners, and physician assistants will tell you that having patients come in and ask, can you treat me with this medication, is a huge time waster because that leads to a long conversation about why that medication is, in most cases, not the proper drug for their disease. How much money is currently spent in the United States on direct-to-consumer drug advertising? The 2023 figure was about $13.8 billion.
Where does TrumpRx fit in this situation? Well, at the time of writing this column, TrumpRx had 43 drugs from 5 drug companies participating. Not all the drugs distributed or manufactured by those companies are listed. The drug discount site GoodRx is reported to have 6,000 drugs listed. So to date, TrumpRx involves 43 of those 6,000 drugs. Leveraging the full weight and power of the United States of America. Did that really, leveraging the full weight of the United States of America, result in only 43 drugs? Is that what the full weight of America really means? Is that the limit of our negotiating power. This guy was supposed to be the master of the art of the deal. That
Mhm.
doesn't seem like a deal to me. Does it to you?
No, not at all.
So it seems as though the art of the deal really is not that he negotiated 43 drugs, it's that he had a portion of the American population into believing that he was doing something while keeping his pharma bro cronies happy. That may be the art of the deal. Can a person buy from TrumpRx? TrumpRx does not sell drugs. For some drugs, there are coupons, and for some drugs, the patient is directed to the drug company's website for discounts. And who is eligible? Only people who are buying drugs with cash are eligible. In other words, if you have a prescription coverage in your health insurance, TrumpRx does nothing to lower your cost of your insurance company or your insurance company's cost. Another issue is that 20 of the 43 brand name drugs on TrumpRx have generic equivalents on the regular market, which are the chemical equivalents. I looked up varenicline, brand name Chantix. The price on TrumpRx is $94.34. The price for the generic at Target CVS is currently $36.61.
Here is a direct quote copied from the Trump RX website. Thanks to President Trump, the days of big pharma price gouging are over. Leveraging the full weight and power of the United States of America, the president has ensured every American gets the lowest prices on prescription medications in the developed world. Unfortunately, as you have seen, this statement from Trump RX is not accurate. It is also worth mentioning some other facts about the 43 drugs on Trump RX. There are no antibiotics, no anti-cancer drugs, no thyroid drugs, no birth control pills, and a lot of other gaps. Minnesotans and all U.S. residents deserve effective action to achieve sensible drug pricing. Triumphal but untrue messaging is not going to get us there.
More like Trumpful. So yeah, basically the article is saying that Trump RX sounds a lot bigger than it actually is.
Right? Like 43 drugs out of 6,000, and only if you're paying cash. That's not really solving the problem.
And the price comparison with the generic at Target, wild. Almost 3 times cheaper to get the generic.
So yeah, much promised, little delivered really does sum it up.
Viewers, what do you all think? Is Trump RX a step in the right direction or just a whole lot of hype?
Drop your thoughts in the comments. We want to know.
Thanks for watching
Thank you.
and see you on the next edition of Healthcare in the News.